Are you turning 65, but you're overwhelmed, you're confused, and you just feel like this whole Medicare thing just seems so hard to learn and you don't know what options to go with? Well, today is part 2 of a video series that I'm putting together, or that I've put together for all of you, to simply break down Medicare and make it easier to understand so you can get the best plan to meet your healthcare needs. What's up, friends? Rob here, the Medicare Minister with Agape Insurance and Financial Group in North Mississippi. And once again, this is part 2 of a 3-part series that I'm putting together for all of you to help simplify Medicare. If you remember last week, and if you don't remember, you can go back at the end of this video and there'll be a link to part 1, because you'll need to watch that to make sure to have some context so you can understand this part 2 video. But last week, we talked about just Medicare, who qualifies for Medicare, when do you go on Medicare, how do you sign up for Medicare, do you got to go on Social Security and Medicare at the same time, and other questions like that we address. So I definitely want to encourage you to go back and watch that. And once again, the link to that will either be in the video description or at the very end of this video. Well, today we're going to dive into our 2 main choices. Once we get a solid foundation of what Medicare is, now we need to decide which Medicare option is best for us. And if you look here on the screen, there's 2 main options. One is to stay on original Medicare, your Part A and your Part B, your red, white, and blue card, and get a Medicare supplement, also known as a Medigap plan, a prescription drug plan, and then any other ancillary plan that you may need, such as like dental and vision, cancer, life insurance, plans like that. And then option number 2 is what's known as a Medicare Advantage plan, or Part C plan. In today's video, I'm going to be breaking down the original Medicare route for you, and the Medigap and the Part D plan, so that way you have an understanding to see if this may be the best situation for you and your current and future healthcare needs. All right, so here's one of the main pros of a Medicare supplement or Medigap plan. You can go to any hospital, any doctor, anywhere in the U.S. that accepts Medicare without being referred. So many people, or many Medicare beneficiaries, love this option because with a Medicare Advantage or Part C plan, it is more restricted to a network, and there's a couple of more challenges that you may have to go through in order to see the doctor or the specialist that you may currently have or may be referred to in the future. Once again, be looking for that video next week when we drop that part of the series. So Medicare supplement plans, I'm not going to go through all of these, but the most popular one, not only in my neck of the woods here in North Mississippi, but also throughout the country, is the Plan G. It's what I call the Cadillac plan. And it simply covers everything except for what's known as a Medicare Part B, that's B as in boy, deductible, which means that is the annual deductible that Medicare has put together, and it's $240 for 2024. All right, so what does the Medicare supplement, or also known as a Medigap plan, cover? It covers 100% minus the $240 Part B deductible. Once again, that's for 2024. It covers the Part A deductible, which is $1,632 each benefit period. So it covers that. Go back and watch that Part 1 because we talk about the Part A deductible. It does not cover the Part B deductible, which we've mentioned several times. It covers the Part B coinsurance, which is the 20% that's left over, because your red, white, and blue, your Part B will cover 80%. Now, this is a big deal because that 20% has no limit to it. It's uncapped. Every once in a while, I run into Medicare beneficiaries that go, well, I'm just not going to get anything. I don't want to go to Medicare Advantage. I can't afford to go on a Medicare supplement. So I'm just going to stick with the red, white, and blue card. They're able to do that. That's their choice. We do not recommend that because that 20% is uncapped. That means if I go ring up $100,000 in medical bills, my red, white, and blue, my Part B will cover 80, but it leaves me 20%, which in this case would be $20,000. Part B excess charge is covered. But here's what I want you to understand about when it comes to a Medicare supplement, because I run into this all the time where people either call me on the phone or they come in here locally to my office, or if I'm on a Zoom call with them, they have a specific company that maybe they've heard a church member, a friend, or a family member tell them you should go with XYZ company, whether that's Aetna, Mutual of Omaha, United Healthcare, just to name a few. And they want to go with that plan because it's been recommended to them, or that company supposedly pays the best. Well, when it comes to Medicare supplement plans, They all have to pay the best because Medicare regulates it. They standardize all the plans, which simply means a Medicare supplement plan G with company A has the same benefits as a Medicare supplement plan G with company B. And here's what I mean by that. I see some people that will go with a specific carrier and wind up paying 20, 30, 40, sometimes $50 higher per month, and they could have got the same benefits with company B and saved all of that additional premium. This is why it's important that you work with what I call a Medicare broker / advisor, which means they work with multiple companies. And that's what we do here at Agape's. We work with multiple companies. We have a tool that we put all of your information in, and it spits out the best premium price plans for your specific area. And by the way, if you're getting value out of this video so far, please take a moment to hit that like button for us. That just helps us get this information out to more Medicare beneficiaries like yourself. So I can't stress this point enough. A Medicare Plan G, a Medicare Plan whatever is the exact same with Company A as it is with Company B. You just need to make sure that you deal with somebody who works with multiple companies, so that way you don't wind up paying more money for something that's not going to benefit you in any other way. All right, so let's talk about the Medicare Part D prescription plan. One of the things that we do here at Agape is we ask for a list of all of your medications, and we put them into a state-of-the-art tool that basically tells us here are the best options for that specific zip code. You always want to deal with somebody who's going to review all of your medications, because I believe, to me, this is probably the most important part of the whole Medicare journey, because not doing this and getting with someone who knows how to do this properly could cost you hundreds, even thousands of dollars. Your enrollment, your initial enrollment, is 3 months before your new to Medicare or turning 65 date, the month of, and then 3 months after. So you definitely need to make sure that you get this right. If you're on Medicare, or if you go on Medicare, one thing you need to be aware of is that you have an annual election period. AEP, sometimes it's referred to as open enrollment, and that is from October the 15th to December the 7th. And any changes that you make during that open enrollment season, the changes will take effect January 1st of the following year, or the upcoming year. Now, this is very important to highlight because you're never stuck on a drug plan. Medicare is going to give you one time per year, and there are some other exceptions that we can get that we highlight in other videos, but the main one is AEP. So you're never stuck on a drug plan, and these drug plans are year-by-year contracts, right? They're year contracts, and generally you will either get it by email, by mail, maybe both. You'll get what's known as an annual notice of change letter that will tell you, that comes straight from the carrier that you're with, to tell you of the upcoming changes for the coming year to your drug plan premium, co-insurance, deductibles, etc. Okay, so it's super important that you review your drug plan every year, because once again, it could cost you hundreds, if not thousands of dollars per year. All right, so once again, you see the AEP from October the 15th through December the 7th. And these tier of drugs, the reason we want to review it is because these drug tiers can change. So the company that you're currently with could change the tier of that drug. So this year, your drug may be covered really well, but going into 2025, they could change the formulary. They could change the tier of the drug. That means it could be covered or it could not be covered. And so those are things that you do want to review on a year-by-year basis. Now, if it's tier 1, tier 2, you typically have low copay. Sometimes you don't even pay anything for it. But once again, the average deductible for this year in 2024 is $545, which means if I have higher tier drugs, such as a tier 3, tier 4, tier 5, it's going to trigger that deductible, that $545 deductible, which means I have to meet that before I get that post-deductible price, okay? So this is why it's important that you take a look at all your drugs and find out the tiers and make sure that they're covered. Other thing I'll mention real quickly is you want to be in a preferred pharmacy. So in the Medicare realm, you have out-of-network, which just means you pay full price for it. You have a standard pharmacy. Most of the time, your standard pharmacies are going to be your ma and pa, your local pharmacies, and you can still use those in many cases. However, you're just going to pay more money for that specific drug. We really want you to be in a preferred pharmacy. And so that preferred pharmacy is either going to be like some of your big chains, your big boxes, like the Walgreens, the CVS's, the Publix, the Kroger's, and so on, okay? Or many Medicare beneficiaries today are getting just really good pricing by using the mail order for each particular carrier. So we definitely want you to be in preferred. If you can't do the mail order, it's okay to use the standard, but you just want to be aware that you could pay, or that you will pay in most cases, a higher price for that drug. And while that may not be a big deal if you are only on 1 or 2 medications, it can become a big deal once you start taking 8 or more medications, okay? Now, here are some examples of some low and high tier drug. Low tier drugs, lisinopril, that's very common for high blood pressure. Losartan, the same. Your statin drugs like atorvastatin for cholesterol, metformin if you're diabetic, omeprazole if you have some stomach issues. Here's a common one, levothyroxine, which is the generic for Synthroid if you have thyroid issues. On the high tier drug side, here's some common ones, Eliquis, which is a blood thinner, especially it's being diagnosed for people that have AFib. Xarelto is a blood thinner. Jardiance or Januvia if you're diabetic. Trulicity is another diabetic drug. Symbicort, which is a COPD inhaler. And then you see the other ones there. So these high tier drugs will trigger this particular deductible, this $545 deductible that comes with most of these drug plans. So this is why you really want to take a look at this and take it very seriously, because once again, it could cost you a lot of money. Now, the other thing that I want you to see here is if you go back and watch part 1 of this series, we talked about a Part B premium upcharge or penalty that you could pay depending on which income bracket you fall into. Part D has the same thing. They call it IRMA, or income related monthly adjustment amount, and they're going to go back 2 years to determine that. So your 2022 is going to determine your 2024 Part B premium. If you look here on the screen, most people are going to fall into that top category. They're not going to pay an upcharge or a penalty. But if you start going down through the different income brackets, if you're above $103,000 per year as an individual and up to $129,000, or if you're married and you're above $206,000 for the year up to $258,000, if you look here, you're going to pay $12.90 plus your Part D premium. And some of these Part B premiums, depending on where you live across the country, are as low as $0. In my area, the lowest one is 50 cents. So if I was to use this example in my area, it would be 50 cents plus $12.90. So you can go down here and look on the income brackets, and you can Google search this as well, and you can pull up this graph if you want to do some more due diligence, but it's just going to give you the extra upcharge or the penalty that you will pay depending on where you fall in these particular income brackets. So once again, this is what's called an IRMA penalty, or income related monthly adjustment amount. And you need to be aware of this when you sit down with a Medicare advisor. If you do not have someone that you trust or that you know, you are more than welcome to call the number on the screen. Either myself or one of our seasoned Medicare advisors would be more than happy to help you get this right the first time. And we work in most states and we work with most carriers. However, if we are not in your particular state for whatever reason, we have a trusted network of seasoned advisors that we can refer you to make sure that you get this right. Now, one thing that I do want to point out real quickly before I move on with this slide is I get a lot of people that say, well, Rob, I don't take very many drugs. I take, 0 drugs, or I take 1 to 3 drugs. I can go up here to the local big box store and I can get them for pretty much nothing or just a few dollars. Well, you definitely want to go on a Medicare Part D drug plan when you're new to Medicare, because if not, Medicare will penalize you for every month that you do not have one. So even if it's just getting the lowest one, and once again, in my area, that's 50 cents, that's going to keep you out of the Part D penalty. And it says here in the middle, Medicare calculates the penalty by multiplying 1% of the national base premium. In this case, for 2024, that's $34.70 times the number of full uncovered months you didn't have Part D, or what's known as credible coverage. All right, so you definitely want to make sure you're aware of that, because in most cases, the national base beneficiary premium increases most years, and that 1% is going to be based off of that increase. So if that premium goes up, then you're going to be penalized 1% of that new base amount, or the national average base amount. Okay, so I can't stress this enough. Go on a Medicare drug plan, even if you don't take very many drugs or none at all, and you're just not paying very much for this. Now, I put up our zip code here. It's going to be different in your area, but some of these carriers are across the country. Here's a few examples of some carriers. You have Aetna, Cigna, Humana, Mutual of Omaha, United Healthcare, WellCare, and there may be some different ones in your areas. Now, let me address another popular question that we get asked all the time. Well, Rob, what if I'm on high tier drug? I can't afford to pay that deductible, or I can't afford to go in what's known as the donut hole or the coverage gap. Well, there are some solutions. Some of our beneficiaries have found better savings through Amazon RX. I didn't even know Amazon had a pharmacy till a couple of years ago, but some of our Medicare beneficiaries and our clients are getting better pricing through Amazon. Some are going through Canadian pharmacies. Most of these carriers have what's known as a manufacturer program that you can qualify for and get that high tier drug at a heavily reduced route. Some of you may qualify for what's called extra help. Okay, so $4 and some change for your lower tier stuff, your lower tier drugs, and $11 and some change for your higher tier medicines. So you definitely, if you feel like you qualify for extra help, once again, we have videos for that on our channel that you can go research that more in detail, but we definitely want you to make sure that if you do qualify for that, that you apply, because that could become a big deal, especially if you are taking some really high tier drugs. And then just finally, one more option is the 340B program. These are community programs. Most areas have some form of 340B clinic that has certain drugs in their formulary that you can qualify for to get those high tier drugs at a heavily reduced price. One other option may be prescription savings cards like you see here on the screen. A lot of people use GoodRx. We personally like this one better. And you can find a link to that in the video description and download the card at no cost to you. So sometimes you can use just free discount cards like this to get better savings on not only your high tier stuff, but even your low tier stuff as well. Okay, so those are just some cost saving options that you can utilize to combat the high tier drugs, the price of the high tier drugs. Okay, so I'm going to stop there for today's video, and I pray that you got value out of it. Once again, please take a moment to like. That just helps us help more beneficiaries get found by more Medicare beneficiaries like yourself. Also, put some comments below. If you have some questions about this video that maybe we didn't address in this video, we always reply to our comments, and then subscribe. That way you're notified every time we drop fresh content like this. Finally, we would love to work with you at no cost, no obligation to you. You can go Google search us and you can see that we are very proud to have over 60 5-star reviews, people that we've worked with to help in the Medicare and health insurance space to make sure they get the best plans for their needs. Simply call the number on the screen, or down in the video description, you can go to our website, fill out a contact form, and myself or one of our seasoned advisors would be more than happy to reach out to you. And once again, at no cost or no obligation to you. Well, I prayed you got a value out of this video today. God bless you guys, and we'll see you on the next video.